I'm Tommy Teshima, owner and speech language pathologist of Duncan Lake Speech Therapy, and we're very lucky to have a special guest with us today, and I will let her introduce herself.
Hi, everybody. I am Alma. I am a speech therapist in California, and Tommy and I went to grad school together at San Jose State. I don't know, a little bit about myself. I didn't know what a speech therapist was until I was an undergrad, and I met a speech therapist in my ABA company who said, pretty much change your major, and that's what I did. And so I love speech therapy, and it is a career for me. And then in grad school, I got a grant for AAC, which gave us extra trainings, and we had an extra AAC clinic, and it's taught me all that I know about AAC. And I have an Instagram account called AAC for You and Me, where I talk about all things AAC.
Alma is also blessed with the but she's blessed to be bilingual, which, I mean, what percentage of speech pathologists are bilingual? Do you know it off the top of your head?
I don't, but I mean,
single
just
digit.
Looking at our cohort, it was like, I don't know, maybe like 4% of the whole. Yeah.
And we went to school in a rather diverse part of the country.
Exactly.
So I'm willing to wager that even our cohort was much higher in representation of bilingualism than probably cohorts in other parts of the country. So I'm really excited that you're here. So thank you.
Yeah, no problem.
Do you want to tell us a little bit about what you do currently at your jobs, plural?
Yeah, so I did my CF actually at a hospital. And I always start off with that because I didn't get a medical externship during my grad school career. So I got the chance to I found a clinical fellowship job that took me and trained me in all things swallowing and rehab and all those things. But it also exposed me to the outpatient setting, which is where I did a ton of assessments for speech generating devices. So this is like a device that a medical insurance pays for as opposed to like an iPad. And that is where I did the bulk of my assessments in bilingualism, because I had, early intervention kids who had Spanish as their primary language, and then they were starting in the school. So I did get to work a lot with bilingualism and AAC. Now I'm at a school, and it's much more cookie cutter, articulation, language disorders, and I'm not seeing a ton of AAC. Although I do have like one or two kids that are like have apraxia, and I'm like wanting them, like I do AAC with them regardless, but I'm wanting to get them their own devices. And I use AAC just as with all my students that have language disorders benefit from AAC, whether it's in the form of a low tech board or we are using the iPad for vocabulary, what have you.
Quite a bit. Something that came up when I did like a crowdsourcing post a couple of weeks ago about things people wanted to know. And one thing that came up over and over again was being able to decipher the difference between something like a language difficulty being a result of like learning a new language, like being bilingual, or something actually being a language disorder. So I'm wondering if you would like to touch on that and how you as a speech pathologist, especially as a bilingual speech pathologist, are able to suss that out.
Yeah, this is like the age-old question. It's like what came first, the chicken or the egg? Like it's just asked all the time. And I think I had mentioned that it's difficult if I'm answering this question for a monolingual SLP or a bilingual SLP, because personally, like I've never had to assess using a translator, but I know that if you're a monolingual SLP, that's like the first thing you have to do is find a translator that's, knowledgeable. And as a bilingual SLP, I know that we have to kind of address both of the languages, see which one is the dominant language, and understanding that some kids are going to have difficulties because they are processing two languages. Their progression might be slower, but it's not causing their disorder. You're going to find that a lot of times if they can't say, the pronouns in English and you look at their Spanish, they also can't say them in Spanish. I do a lot of case interviews. I ask the parents, and a lot of times the parents will tell me, and I don't know if it's because I am Mexican, but they'll like really go into detail as to like, he also didn't, do all these other things, these different milestones. And then sometimes the parents might even tell me that they themselves had trouble in school. So that's one of the the big pieces is like the interview with the parents. Just from speaking to the parents, and I go into the classroom, and the kids with the language disorders are overall lost. They're lost in the classroom and they're lost at home. Like the parents will say things like, it's like I'm talking to a wall. It goes in through one ear and out the other. And after we've, made sure that they don't have a hearing issue, a lot of times like these kids are essentially very lost, and that's how you know that it's really a disorder. And like I said, in both languages. Mm-hmm. It seems very easy to do, but it's not. I have a lot of students right now where they didn't have like a good foundation of their Spanish skills to begin with, and they're losing their Spanish like rapidly, like I don't know, from watching YouTube or what, but they get to kinder where they're, it's all English, and so they're losing the Spanish, they're learning the English, and they never had a solid foundation of language in either, either English or Spanish.
Something that has come up is the idea of like accents and why we don't do accent modification in schools and why it's an elective service outside. Do you maybe want to touch on that a little bit?
Yeah, I don't have a ton of experience, but I just know that in the Bay Area, like that's a hot, hot topic, and a lot of, people that work in tech that are coming to us they are immigrants of different countries. They will seek out the therapy and they'll pay for it and they'll do that stuff. But that's because they're using it to gain like professional mobility. But for kids that are in schools, it's not necessary. I mean, it will come with time, especially if they just came to this country. Just the issue of acculturation as a whole, it's not a problem at all, I would say. And it's not ethical, I don't even think. I don't even think it's in like if you look at the ed code, I'm pretty sure we can't give accent wall therapy. But yeah, if they're adults and they're looking to seek it out and pay for it and do it, then that's fine, but not for kids.
And I think the idea of placing that sort of idea on kids, like we're gonna fix your accent, places a value on one language over another, which as citizens of the world is not something we would like to do.
Yeah, and I'm sure kids don't even know what is right or wrong, and so now we're teaching them that,
A topic that's come up a couple of times over the last couple of months, even just with my practice, but I know that this is kind of a common question that I hear from parents is, well, how do I know if I need to even refer my child for speech therapy, if I need to ask my doctor for a referral? How do I know that it's a difference versus a disorder? Do you have any tips for parents who are in that situation?
Well, just in general, if at home they're having, no trouble communicating with their caregivers and they're using appropriate language, including your pronouns and grammar usage, then it really is the fact that they're learning a second language and the progression is coming. Like it's a second language acquisition thing, but it's not a disorder. Definitely not if they're communicating well at home with their parents. And then taking them out of bilingualism is another. I'm at a bilingual school, so that is one of the number one questions we get is, should I take them out of the bilingual education? Is it, causing their disorder? And it's not. And monolingualism is not going to cure your difference or your disorder. In fact, I've seen that a lot of kids that truly have a disorder, they prefer one language. So it's almost like the bilingualism, will help you master. So I feel like definitely I encourage bilingualism as much as possible. And definitely if at home they're not having any problems, then it's definitely a difference.
Alma's passion project, or I shouldn't, maybe passion project is not it, but her passion is the intersection of bilingualism with alternative and augmentative communication. And maybe I'll let her explain that, and then we can. So maybe you could take us through just a little quick 30-second crash course on AAC, and then we can talk about how bilingualism intersects with that.
Yeah, so AAC is like a broad word, I guess, for communicating with a means that is not speech. So a lot of English language learners benefit from the use of visuals and the use of like sentence prompts and things that are, in text and they're not actually saying. So I have a lot of Spanish speakers, bilingual children in my classrooms who I use AAC with, because it just helps bridge the gap between what they understand and what they can express. Similarly, when I've worked with AAC devices, some of the parents don't speak English themselves, and then they look at all the vocabulary that is listed on there, and they're like, "Oh, that's how you say it." Like
My question to you is, if a child is bilingual or even monolingual in a non-English language, and they are nonverbal, they are minimally verbal, and they need some sort of an augmentative or alternative communication device or program of some variety. So how do you navigate that process, and how would you recommend parents maybe get the process started?
Yeah, it's similar to like the bilingual assessment. Like, you really do have to look at language dominance and who is the one that's going to be working with the device and modeling on the device. If that person is a monolingual SLP and their native language is English, like, more than likely the device is probably going to be kept in English. But if you teach the parent, which you really should do, because otherwise the device is going to be abandoned, if you teach the parents how to navigate the device and work with the device, program words on the device. Again, this is like I'm talking about an iPad as opposed to a low-tech board. Then yeah, it should be in Spanish, because they have the language dominance that they are going to model to their child for them to, gain both of those languages, which it is possible to be a bilingual AAC user. So it definitely depends on what language is going to be modeled the most.
We have reached the point in our interview where if there's something that we haven't talked about that you would like to talk about, the floor is yours. You may have at it in whatever way you want.
So, making AAC more accessible to everyone, like, that's one of the main issues I think we're faced with. The whole issue of like our kids losing their Spanish or their second language, or their first language becoming their second language really quickly. That's another issue that's coming up a lot, at least at my job. And I know that you had asked about the differences between, if it's a difference or a disorder and kids getting, overqualified for SPED services. I actually deal with the opposite of that. I feel like a lot of kids are not assessed until they're in second grade because of the reason that they're bilingual and they're learning a second language, and we should give them time. But we miss out on all those 2 years of like therapy that they could have gotten, or resource support that they could have gotten. And by that time, they're going into third grade when they're starting services, and it's really, really tough for them. So I'm actually running into that issue a ton.
So never be afraid to contact your friendly neighborhood SLP, and we're always here to help.
Exactly. Very true.
Well, thank you, Alma. I appreciate it. And we'll have to have you back as soon as possible to chit-chat.
Yes, this is fun. It's nice to get out of the monotony.
Alma has a brand new baby.
Yes.
So we're very happy that she was able to take some time away from her little one, who is like the most precious little cheeks, to come and talk with us. So
I love like not being in mommy mode for a little bit and then going back. Keeps me sane. Plus, I could like talk everybody's ear off about these things, and so it's nice that people are out there listening.
Well, that's great, because you'll just have to come back. What are you doing tomorrow? So we'll figure something out.
Sounds good. Well, thank you for having me.
Thank you. We'll see you later.